So I suppose, first of all, it's often a family member actually goes to the GP saying, I think mum or dad has memory problems, is often where it comes from. GPs often wouldn't notice themselves, unless it's someone they know really, really well. So GP would often do some simple investigations to make sure there's no medical reason why, like anemia or diabetes or something that might impact on memory. And then they would usually refer, in Ireland now, to a memory clinic, if there's one in the area. If it's straightforward memory problems, it's probably best to go to a memory clinic and get a good medical review, medication review, and the appropriate scans and other investigations. If the memory is tied in with maybe low mood or anxiety, they're better to come to psychiatry.
So if a GP notices signs of dementia, one of the things they'll do is a quick test during the appointment with the person, and then they'll discuss with the person and the family member, if the person is happy with that, around referral to the next service. So that can be the Psychiatry of Later Life services, or in some areas around the country, there are new services opening up called Memory Assessment and Support Service, or MASS for short. So if there is no concern around mood or any other issue, if it's just a memory concern, then the GP can make a referral to the MASS service. All the other referrals then would come to the Psychiatry of Later Life teams. In some instances in the past, a person may have been referred to the geriatricians, but that's usually if there is also an issue around some physical complaint or a medical issue underlying.
They might do a screening test. They will then order a few investigations to make sure that there is no deficiency or an active medical condition that is causing the memory problems or other difficulties that a patient is noticing. So that's usually the first thing that happens when a person who has concerns about the memory or the family brings it to the attention of a doctor. So after those tests are done, the doctor may then decide, which memory clinic should the patient be referred to, or which service is most appropriate. So depending on where the patient lives, for example, where we are, and at several places in the country now, there are dedicated memory assessment and support services that a patient can be referred to. And when the patient goes to those services, then it is a formal assessment. Sometimes some teams like ours, we undertake a screening at home. Others might be doing a basic screening first at the clinic. It may take one appointment, and sometimes it may take 2 or 3 to get the diagnosis finalized, to understand, as we see for a lot of people, if it is a mild cognitive impairment, that it is not a dementia, or in other cases where there is a dementia. And the point of this exercise is not to put a label on the patient. The point of this exercise is essentially to provide an answer, a clear answer and understanding to the patient, so that not only that they find answers, that they learn to live well with it. They understand, all of the supports around them. They understand that nothing changes other than the fact that they didn't know it before and now they have received a diagnosis. So it is about empowering a patient and their family to live well with dementia, if that's the diagnosis. If there is a mild impairment, oftentimes a patient is invited for a retest in a year's time. If it is at a stage of dementia, the patient is linked with dementia support services. Then there, depending on the patient's needs identified at the time of assessment, there may be further reviews with the memory clinic or just with the support services. A lot of the times, a lot of the needs can be met for a patient who has dementia at home through their primary care team. So usually the memory clinic, sometimes even the GP can link the patient in with the primary care team so that those needs can be assessed and can be managed in the patient's own home.